Yeah, hi everyone. Good evening. Today from the PCOS Society of India and Vijeta, along with Philips India, we want to talk about lifestyle modification in PCOS. All of us know that PCOS is very common, extremely common. It's up to 10% of adult women and up to 20% of adolescents. And the mainstay, see, PCOS is such a perplexing disease. It affects most of the organs in the body, and then we don't know exactly what is the pinpoint reason for that. So that is the reason the treatment becomes very difficult. So lifestyle modification becomes the first mainstay of treatment. So to discuss the lifestyle modifications, we have a very good panel with us. We have a physician, we have a psychologist, we have a nutrition specialist, and we have a yoga expert with us today. So, hi, good evening to all the panelists and good evening to the listeners. And can I have the CV of all the panelists? Yeah, introducing Dr. Siddharth Gosavi. He's a young physician. He's MD, DMB, internal medicine, and then he works in my PCOS center. We have a PCOS center in Bangalore, and he works in PCOS center. And he has published a lot of research articles in medicine subject, and then he is a recipient of the Scientist of the Year award from the American College of Physicians. Recently, he went and picked up the award. Welcome, Dr. Siddharth. Next.
Thank you, ma'am. Thank you, ma'am.
Next, please. Yeah, and we have Miss Prutha Handigol. She is a nutrition expert with more than 15 years of experience. She is actually working with me since 15 years, and she takes care of all the nutrition counseling for pregnancy, gestational diabetes, and she has worked with a lot of PCOS patients, more than 1,000 patients with PCOS, with giving very good results. Welcome, Prutha. Next, please. Yeah, we have Miss Nayana. She's a certified yoga guru, and she is associated with my PCOS center. She has taught yoga for a lot of PCOS patients, and also she does prenatal yoga and yoga for menopausal women. Today she's going to talk about yoga and also exercise, the benefits of exercise, and she's going to demonstrate some very good asanas which are very useful in PCOS. Welcome, Nayana. Next, please. Yeah, and we have Ms. Ramaya Krishna. She is a psychologist. She's a clinical psychologist, and she has got a master's in psychosocial rehab, and she has 11 years of experience. Again, she has works with me in my center, and she does counseling for children and for PCOS patients and menopausal issues, and also women with a lot of mental disorders. Welcome, Ramya, for the panel.
Thank you, ma'am.
Yeah, so I think we can start the panel by just my introduction about the PCOS is about how prevalent it is and why it is so important to control, because why the PCOS society is formed in India and all over the world, because I think, Ramya, you need to mute yourself. Please mute yourself. So why PCOS is so important, why there are societies being formed in PCOS, why there are so many webinars, discussion, blogs all over the world, because it can cause a lot of complications apart from reproductive problems. The PCOS has got three different issues. One is the cosmetic issues, where there is unwanted hair growth on the face of the body. There is a lot of severe acne or pimples, and then scalp hair fall, and then obesity. These are all the cosmetic issues. And again, there are these bleeding issues where the cycles are irregular and prolonged bleeding. And third is the infertility or the inability to conceive or difficulty to conceive children. These are all the three complications we gynaecists generally understand and then treat. But then do you know what all complications, long-term metabolic complications this can cause? So we'll ask Dr. Siddharth, what as a physician you understand about the complications of PCOS? You've been working in my center. So what all do you think the women with PCOS face as challenges as a long-term metabolic complications?
Good evening, everybody. Good evening, ma'am. Thank you for the opportunity at the outset. So normally the complications of PCOS is divided into short-term and long-term complications, ma'am. So under the short-term complications, obesity is very common, infertility, dyslipidemia, that is increased triglycerides and bad cholesterol, LDL cholesterol, VLDL cholesterol, Hirsutism, again, where there is male pattern-like growth on the face, or back, or even the chest. And then apart from that, even there's impaired glucose tolerance again, and acanthosis nigricans. All of these are short-term complications of PCOS. And under long-term complications, we have type 2 diabetes mellitus, hypertension, cardiovascular diseases. Especially in the 2023 guidelines, a lot of emphasis has been given on the cardiovascular diseases, and endometrial cancer. Sleep apnea, which is actually a very ignored disease in our country, especially. Depression, another very ignored disease. So all of these are long-term complications of PCOS, ma'am.
Yeah. So like when generally I treat the patients for the reproductive complications, and then I will be referring to endocrinologists or the physicians regarding the insulin resistance and impaired glucose tolerance and all the other complications. What do you think now when they come to you first? Do you straight away start medications? What are the different medications generally you use for these metabolic complications? And what do you generally jump and start the medications, or what is the first thing you want to tell me?
No, ma'am. First, we go for the lifestyle modifications, ma'am, where we give a lot of emphasis on the weight loss, especially even 5 to 10% weight loss itself leads to normal ovulatory cycles. So that itself is a very big change which we should aim for. And the patient should be educated, ma'am. There is something called the SMART goals. That is SMART, and then measurable, achievable, realistic, and timely treatment and lifestyle modification, where the patient should accept, first of all, the diagnosis. They should be able to monitor their own diagnosis, monitor their progress, and then they should reinforce the activities. And then once the result has been achieved, they should also maintain the relapse. So the relapse should not occur. So those kind of measures also have to be taken very clearly into account. So, and we, of course, we go for the basic investigations like fasting blood sugar, postprandial blood sugar, HbA1c, liver function test, especially to look for hepatic steatosis, which is also a complication of PCOS. So all of these we first go for. So first we try to educate the patient and make them accept that we can do lifestyle modifications as well as dietary modifications, especially dietary, where there'll be 500 to 1000 kilocalorie deficit per day. We should aim for that. And then in lifestyle, at least 150 to 300 minutes of moderate intensity workout per week. So that is very important in the lifestyle modification. Only after trying all these, then we should think about the medication protocols, ma'am.
Yeah, true. So as Dr. Siddharth was telling, suppose there is a patient, we know obesity is present in almost 70 to 80% of women with PCOS. So like they measure around 70, 80, 90 kgs, and then their ideal weight is around 20, 30 kgs lesser than that. So we can't just jump and tell them, lose 20 kgs and, in 6 months and come back. We have to give them a very achievable goal. That is in the SMART goal. That is the first is the specific goal. You have to lose weight. You have to lose 5% of your body weight. Suppose if you are 100 kgs, lose around 5 to 10 kgs. Okay, and then next is measurable. So the weight we can measure now. It is not something like you become thin and come, so we can measure it. And then achievable. We can't give 3 months and then lose 25, 30 kgs and come. And next is realistic. It has to be a realistic goal. Like something which we can't, the girl can't achieve. If we give, it is very difficult for her, and she'll run away from you and never come back. And it has to be time bound. I can't lose the 10 kgs and come after 1 year or 2 years. So there has to be a specific goal. So this kind of SMART goals will help them to achieve the weight loss. What do you think? What metabolic changes? It's not only PCOS. I think you need to mute everyone. Yeah, thanks. So, Dr. Siddharth, apart from PCOS, even in diabetes and dyslipidemia and in high BP and in obesity, you tell weight loss. What are the general benefits of weight loss? Apart from losing weight, what are the metabolic changes you observe when they lose weight?
Yes, ma'am. So especially in PCOS, when we lose weight, the ovulation rates become normal. The ovulation cycles become normal. There'll be reduced hyperandrogenism. That is, the circulating androgens reduce, and then there'll be then reduced triglycerides and reduced cholesterol, which again is a benefit which is present. Then apart from all this, also the menstrual cycles become regular. The hirsutism chances become lower. So all of these are the immediate benefits of weight loss, ma'am.
Yeah. So apart from the, see, when we say you lose weight, apart from the chances of diabetes and BP and the lipid profile coming down, we also have the benefit their periods will become more regular. They start producing eggs, so the chances of conceiving will become more.
Yes.
And the bleeding, heavy bleeding also will come down. They start looking better.
Yes.
Actually, if you lose weight, that insulin resistance, the darkness of the skin will come down. They look better, they feel better, and also, and not to mention the mental health, they also feel very much better.
Yes,
when they lose weight. Now, the first thing when I send the patient to the dietitian, or when I say dietitian, the first thing they will ask is, should I eat this, should I not eat this? And also when we say the girls with PCOS are more prone for diabetes and they're more prone for insulin resistance. So I can't tell like 18-year-old girl, don't eat sweets in life. I can't tell, don't eat sweets, don't eat chocolates, don't eat ice cream. Means she will never come back to me. She will hate me for her life. So, Prutha, what are the challenges you see when I send a patient to you? Which are the different age groups of PCOS you see, and what are the different challenges in diet you see in them?
The age groups, like you said, it could range from 18 years. It could start in early adolescent, as early as 12 years or 13 years, when, they have just started getting their periods and they suddenly start gaining a lot of weight. That is the age group, where, like you rightly said, you cannot really ask them to stop eating sweets or stop eating sugar, don't go out, don't enjoy food. So, first thing what I do is, listen to them. At least give them your ears and say, tell me what your problem is, how you want to go about it. Understand what they really want to do, or make them understand what PCOS really is. Once they understand what it is, how it is going to affect their health, then, they'll become a little patient and they'll probably, start following the diet, what you tell them to do. Also, I feel, it should not be a diet that, I tell and they do. It should be something they should be comfortable doing. You have to give them options and say, you don't want to eat this, you eat this. So, if you give them multiple options, multiple recipes, probably, they'll get more wanting to follow the diet.
Correct. So as you rightly told, we need to, we have to be realistic. We need to listen to all their whatever. We tell them something called a food diary.
Yes.
A food diary. In the sense, like she'll tell 1 week what and all you eat, you write down and come.
Yes.
So at least that way we can understand how often they are eating, how much junk food they are eating, how many calories they are eating. And also in adolescence, I think, Prutha, we sit with the mothers because they are the ones who cook mostly. They are the ones who control the kitchen. So we have had patients who, after following Prutha's diet, all the family members have become very healthy. From the girl. So they have come and told, no, madam, I realize the importance of the healthy diet. So that way, so when you are deciding the diet of a patient, is there any specific, because in the market there are so many PCOS diets and the PCOS pills and PCOS powders, and this seed is important, that seed helps, this fruit helps. What is your experience and what do you think? Suppose if you say, now, this particular diet is good for PCOS, you think you're going to follow it lifelong?
Ma'am, there is no specific diet for PCOS. It has to be tailor-made according to the patients. It has to be tailor-made according to their stress, their goals, their blood reports, their blood parameters. And also to a certain extent, what I personally feel is diet should be something which is sustainable. It should not be that they should follow for a few months and say, I am done with it, let me get back to eating what I was. Because as we all know, PCOS is not something that is going to just go away. It is probably going to keep recurring if they don't follow the same things in life. So it should be long term. Second, I also feel it should be affordable. Like you said, there are a lot of seeds in the market and we all know they're very expensive. It's not that not everybody probably can take what I tell them to. So probably in the little few things in our culture, whatever is available, you give a similar product to them. Probably then they will be able to take it better. Like for example, we have ragi, which is good. But there are a lot of, these North Karnataka people, they don't eat ragi, they eat jawar. So you give them that option. So you give them options. You can give them similar things which they can do. Seeds are healthy. Nuts and seeds are healthy, but in the proportions that they have to be taken, not just out of the counter and say, I will just pop in a few seeds. Not like that.
So Siddharth, do you agree with whatever Prutha ma'am says? Because I'm sure you see a lot of diabetic patients in your practice. Now the same challenge is the diet. They walk out of our clinic and then we say, don't eat junk food. They're eating samosa right next to my clinic. There is a hotel. So they eat samosa, and when I by chance if I go, they get embarrassed. So now how practical, how do you actually sit and empathize with them and then suggest it? Do you agree with what Prutha says that, have to be little lenient and,
incidentally, as Prutha ma'am said, ragi is a controversy between internal medicine physicians and endocrinologists, because most of the times we advise the Jola products, the Jawari products, because we believe ragi has higher glycemic index. So that is still going on. So yes, ma'am. So we agree with the dietary changes, definitely. And before we think of medication, there are two more important, more crucial factors: waist circumference and waist to hip ratio, especially in men and women. So waist circumference, so we divide it into very low, high, and very high. In men, it is greater than 80 centimeters is very low. 80 to 100 is low. 100 to 120 centimeters is high, and greater than 120 centimeters is very high, ma'am. So for women, we've kept a scale of 10 centimeter lesser. So it's around 70. Greater than 70 centimeters is known as very low, and 70 to 90 is low. 91 to 110 is high, and greater than 110 is very high. And similarly, the waist to hip ratio, greater than 1 is high in males. In females, we take it as greater than 0.85.
Yeah. So as you rightly said, something measurable is the waist circumference. So whenever I give a lecture in PCOS, I tell them, go and stand in front of the mirror and take a measuring tape and measure your waist around the navel. So nowadays the Asian guidelines for obesity, they've been pretty stringent. They are saying any woman more than 32 inches waist is more prone for metabolic syndrome. That is very depressing for us. Only Nayana can be so thin, but we can't be so thin. So more than 32 inches or 80 centimeters itself, now they are doing a cutoff. But anyways, what I feel, what I want to ask you, Prutha, is now it is easy for us to advise patients in these categories. Whenever there is a PCOS patient, I have to tell her now, these things you should never eat, or very, very strictly to avoid. These are the things you can eat once in a while. These are the things you can eat how much ever you want. So if you categorize like that and give a list of food products, but I think they will stick on to it and that will go, because PCOS is an enduring disease. It's called an enduring disease. That means that once it comes, it is going to stay with you for a long, long time, maybe lifelong. So they have to do the full lifestyle modification for lifelong. So if I ask you to categorize food products or food in general, which we have to avoid, second thing which can be taken once in a while in moderation, and food products which you can eat unlimited. What do you say?
Foods that can be eaten unlimited are all your vegetables, because they are high in fiber, they are high in vitamins, they are high in minerals, we know that. So especially things like cucumbers, carrots, radish, any kind of gourds, what happens is they give us negative calories, in the sense they help burn the extra calories in our body. So they can be eating as much as they want, especially green leafy vegetables, methi, palak, even this drumstick leaves, all these, the regular leaves what you get in the market. Again, they are very sumptuous. They taste good. You can make a lot of recipes out of it. You don't require a lot of ingredients to make them. You may not require even oil to make them if required. So those are things which you can eat unlimited. And to add to the free foods, I would add water as well, because, a lot of PCOS patients, the fear of using the washrooms many number of times, they don't drink water. Especially these ladies who work in AC compartments, who are in a corporate setup. So we have to reinforce them to drink a lot of water from time to time, which will, again, I would add it in the free food category. The other foods, restricted foods, will be fruits, because we know that fruits have fructose in them, eventually converts into glucose. So again, fruits, according to me, I allow the patients to eat all fruits. Though we say, things like lychees and mangoes and sitafal tend to have a more of glycemic index, like Dr. Siddharth said. But what happens is that when the craving sets in, it has to be satisfied. Otherwise, what happens, the next meal that they eat too much, and that produces again a glucose load. So I rather say you eat a small portion of it, it's still okay. So fruits, I would put it in a restricted category, but I would say do not eat it after probably 6-7 o'clock in the evening, because we don't do a lot of physical activity post it. Totally avoiding is all kinds of sugary foods, sugar, jaggery, any kind of honey for that matter, palm sugar, coconut sugar. You get variety of sugars in the market these days, so that has to be completely out. Another thing that has to be completely out is foods fried on the street food, junk food. You eat a bhaji pakoda made at home in your own oil, which you bought from a good source. Yes, once in a while you eat it. But anything that is packaged, anything, I say anything that says best before so and so, avoid it. Because we all know anything that is packaged has to have some preservative in it, has to have sugar, salt in it, to give it that shelf life of so many months or years or whatever it is. So that is something which has to be avoided. Yes, it takes a little, push from the patients, their mother's side, to prepare foods. But, you take a little time, pre-prepare everything, and then mix and match whenever you want, I would say is very good. I forgot to mention, free foods, I would also include a lot of dals and sprouts, because protein is again very important to help curb the craving of food which happens in PCOS. So these are the foods that have to be avoided, eaten, not eaten at all.
Yeah, perfect. So basically now there are many studies, international studies, to find out whether this one meal a day and that 2 meals a day and then intermittent fasting and a Mediterranean diet and NASH diet, all those things. They have tried many diets in PCOS. What they have found out is that calorie restriction is the best thing. In the sense, whatever you are taking, you need to cut down your food by 30%. So what I tell my patient is, I am actually very nice to my patients. So I'll tell them, whatever you want to eat. Okay. I won't say don't eat bhaji ponda and they won't like me. So I'll tell whatever, and they're all youngsters, so they will inevitably eat. So I'll tell whatever you are eating, and also that thing, suppose if I say don't eat bhaji from tomorrow, they'll feel so upset about it. They may not be eating it every day, but they'll feel upset about it. So I tell them whatever you are eating, you give a 30% discount. 3 chapatis will become 2, 5 idlis will become 3, okay, and 3 times coffee will become 1. 1 full cup of coffee will become 1/3. And then see, suppose if you are eating pani puri weekly 3 times, make it monthly, once or something, and home prepare, as I told you. So like that way they feel a little relaxed, okay, thankfully this doctor is, not restricting me. Even though I'm 100 days everywhere, they scold me, don't eat this, don't eat that, at least, so that way they're very happy. And then, okay, then also I'll ask them to maintain a food diary, so the fact that they have to write down and come. And Prutha makes them to write down and come, so that the fact that someone else is watching me, that itself will restrict them to eat better or eat lesser. Now I'll jump to Ramya Krishna. Ramya, now it is so easy for me to tell anyone, you start exercising, start dieting, take medicine, sleep early, get up early and all that. But then how motivated do you think these patients with PCOS have, in a sense, what are the different mental health challenges? Because, I think the most commonest component with PCOS complication is depression and anxiety. We have almost around 70 to 80% women with depression and 76% women with anxiety. And, a woman who is already depressed, is already fat, and she already has so many issues. And again, I tell from tomorrow you exercise, go to yoga, means she will never go because she's not motivated. So I'm asking Ramya, our clinical psychologist, what are the different mental health challenges have you seen in our center? Have you seen the PCOS women facing, Ramya? Ramya, are you there?
Good evening, ma'am.
Yes, ma'am.
Uh, Good evening, everyone. First thing, like when we are talking about PCOS and mental health, it is like most effective, like any other mental, physical health issues, what they have. Before that, I would like to say most 30 to 40% of women these days have mental health issues when it comes to PCOD, especially. So they have almost 30 to 40% of women have mood swing also. So when we are like, usually what we are doing here is like we start up with the screening to see how an individual is come with issues. We let them talk. So screening is something where we rule out with depression or anxiety what they come up with. But the physical changes, what is happening in PCOD or PCOS, the changes are, it is affecting their mental health, like their self-esteem is coming down. They are not happy with their look, the body image issues they have. They are like few people have eating disorders now, especially the depression and anxiety what we see. So again, it has varieties or types of depression, or when it comes to anxiety, there are different types. But when we see the initial stage or the basic line, when we see most of them, it is difficult for them to accept the problem in the first line.
Correct. Yeah,
So
so
what?
yeah, I agree with you totally, because psychological counseling becomes an important part of the workup, in a sense, apart from whatever medicines we give, whatever investigations we say, to follow the diet, exercise, or the medical pattern, she needs to be counseled by the psychologist regarding the compliance. We need to ensure the compliance. We just can't tell, do exercise and then go away. So we give a chart. We have to tell them, okay, you have to see how much exercise you're doing, how much yoga you're doing, like that. We have to tell them. So in that context, I think, as Ramaya told, psychological counseling becomes very important. And along with the psychological counseling, Prutha, this question goes to you. Have you noticed eating disorders? That is, people in general, forget PCOS, in general, people are eating more. Everyone is eating more. Do you find that there are some, what percentage of your patients or your clients have this excessive eating, or I'm a foodie kind of disorder?
Ma'am, I think in PCOS, about 80% of the 80 to 85% of the patients will have, binge eating. In the sense, they eat too much at one time and they leave, fast for so many number of hours. One day they do that intermittent fasting where they say they'll fast for 16 hours and eat for 8 hours. Next day they have a function, they eat whatever they want. Next day they will again be in the mood of, doing a diet. So yes, binge eating is there. They tend to overeat foods, and that the craving to eat sugary foods is too much in PCOS patients.
Yes.
Any sweet for that matter. It could be even as the worst thing is I have seen patients who tend to eat even 1 spoon of sugar at the end of a meal because they've not really had a sweet in their meal. So what I feel is when you do the binge eating, you do it unintentionally, probably because of the other factors and other blood parameters, but the feeling of guilty afterwards is also there.
Absolutely.
So
yes, yeah, true. So eating and emotions are very much connected. As Prutha and Ramaya are talking about it, so they tend to eat more and then feel guilty and they put on more weight, and again they feel sad, they go eat more, so it becomes a vicious cycle. So women with PCOS have to be counseled at the same time by the doctor and by the physician. That is the reason I have involved all the specialists in this webinar, so that we have to start. It's like a jump start we have to give to all the people. Now let's. I will just ask Nayana an interesting question. She is a yoga expert. She runs a yoga center near my place, and then there are she has trained thousands of people with yoga. Now this is again not about PCOS, Nayana. I want to know your opinion. People who come with medical issues to you seeking yoga as a therapy. Now, do you find sleeping patterns or sleep disorders? Do you think it is very prevalent in population? And also, do you think you are doing yoga or any kind of exercise will solve?
Yeah.
First of all, I would thank all of you to give me this opportunity to speak here. And coming back to your question, ma'am, yes, most of them obviously till the water goes above their head, they will not come. They will come here when they have no other option, when water has actually crossed. And then, yes, the kind of lifestyle we have, the kind of job they are doing, or the kind of, even at home, I would again, being a mother, I would again try to put it on the family itself, like, you have to set a discipline at home. The parents have to set a certain discipline. At certain time, people have to get a discipline. Because I think all our generation and previous generations followed that. And by God's grace, we are failing. And the thing is that the parents itself, they're doing night shift or they come back late and they're constantly. Because it's fine. And then most of the activities start only after 6, 7 in the evening.
Correct.
Or I said, by 7 o'clock, we have to be back home after playing, wash your hands, get ready, and have dinner and sleep. But now it's the other way around. They start leaving the house only by 6, 7. Yes, the lifestyle, there has to be a complete change, and which has to be started. The discipline has to start. So in yoga, we have 8 limbs: Yama, Niyama, Asana. Asana comes later. Yama, Niyama is the first 2 steps. So you have to discipline, self-discipline, and discipline around us is very important.
Yeah.
The parents
Very true. Thanks to the MNCs, working in MNCs, people are working in shifts also. Siddharth, this question goes back to you. Apart from PCOS, you see a lot of patients, general patients every day. How is the quality of sleep, or in general, in men, women of different age groups? Do you think sleep matters a lot? And please unmute.
Most people, ma'am, sleep only between 4 to 5 hours, ma'am, due to the hectic schedule. And sometimes some people do night shifts, so all of their sleep cycle is disturbed. So what happens is, what most people don't realize is, maybe they're exercising, maybe they're following all the diet which is being prescribed to them, but high cortisol itself, if cortisol is high, whatever measures you take, it will, at any cost, the weight will not reduce, and there will be no weight loss at all. So, high cortisol is something which, the public needs to be educated about. Say, stress itself is a direct contributor to high cortisol, which means even if you're following weight loss measures, even if you're gymming, even if you're dieting, high cortisol doesn't allow you to lose weight. So that is really important, and we will have to really address that, ma'am. Nowadays, there's something called a cortisol diet, and they make ways to reduce cortisol. That is really important.
Yeah, cortisol means steroids. Okay, cortisol is a steroid. See, basically our body or our brain is set in an orchestra. Like hypothalamus is a small endocrine gland which is situated in our brain, which is the one which releases different hormones at different timings of the body, so that the body works like a clock. So you get up in the morning and then you are awake and then you are alert. Then you work, and evening you feel hungry, you feel thirsty, and then you feel like going to toilet. You feel like all those activities are happening automatically, and by night you feel sleepy and all those things, that hunger, everything, so this it controls the emotions also. So when we are confusing the body by doing these night shifts, by sleeping very late, and by seeing the mobile phones with bright lights falling on our retina, so the body thinks that it is a daytime, compared to night. So all this is this kind of a bad lifestyle. Sleep is very, very important. People who sleep less than 4 hours, they are more prone for heart disease, they are more prone for heart attacks, they are more prone to develop depression and suicidal tendencies also. So that is why sleep becomes a very, very integral part of a good lifestyle. So as I was stressing, lifestyle is not only exercise and diet, it is exercise, diet, a good sleep cycle, a good routine, and tension or stress. Ramya, I just want to ask you one question. How many people say I am stressed out and I am tensed up? Whenever I ask you, do you have stress? Every other person says, no, I have stress. I am working, I have stress. Women at home, stress. Students also stressed. And I think the men, maybe they don't open up, or I don't know, I don't see a lot of men patients, but then it looks like, I don't know whether they could be stressed also. Siddharth has to tell. But generally, the whole population seems to be stressed. So what is stress, Ramya? How do you know you are stressed, and how do you manage that?
People, first of all, they get confused between telling that they are stressed or they are tensed.
Okay.
So sometimes what happens is when they say stress, they even a small things they consider it into too much. Like they don't know. Sometimes when they fail to manage certain things, so they say that they are stressed.
Correct.
So stress is something which is either it can be a mental pressure or a physical or muscular stress as well. So when they come to us with like they say I'm stressed out, certain things there is suppressed kind of things which they don't know to put it out, and they feel it is a stress for them. So example, ma'am, we can just consider that basic thing what we see in every individual, their emotions, which is all the thought process which leads to their emotions and behavior. The thinking itself is so much negative, so that always ends up with stress. So the how they manage, how they take it, that is the basic line. So where they don't manage things, it becomes a stress.
Okay. So I think how do we beat stress? What are the different ways of beating stress? A few inputs from you, Ramya.
So we first thing for what we can do is that they have to practice stress management, ma'am. So when we say it is stress, it is like they first we have certain tests which is very uh, 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 uh,
Hello, I think we lost her. Ramya? Yeah, Siddharth, can you pitch in what how do you counsel people who say they have stress?
Ma'am, it's always better to follow a regular schedule. If they plan their schedule well in advance, there would be no chances of stress occurring. So basically, because a lot of professionals we are noticing, ma'am, they don't sleep properly, and then during their work activity in the morning, there's a concept called daytime sleepiness, which is increasing in most people of the working age group. So most people
unhealthy lifestyle. Hello.
Yeah, we're listening. Yeah.
Hello.
Yeah, we can hear you, Ramya. Go ahead.
Ma'am, they can you hear me?
Yeah, we can hear you. Go ahead.
Yeah. Unhealthy lifestyle, what they practice, we have to first change it to the healthy lifestyle, being more active, controlling on their negative aspects, like the negative thoughts or the people around them, or like they have to connect with good people. So they have to avoid all unhealthy habits. So like how we were talking about diet and the lifestyle changing, all those things. Even for managing stress, first thing we have to follow a healthy lifestyle, like the work or the family, quality time for the family. So all these pleasure what they get, that due to that pleasure also they can avoid being stressful.
Correct. Yeah. So Nayana, so this is about see now lifestyle. Looks like we have covered the physician part of it, and how he has to. It is a multidisciplinary thing, and how diet, which are the must eat and don't eat stuff. And then I told you I'm little more lenient than Prutha. I say okay, you eat most of the food, but at least give us the tips and discount. And Ramya says how mental health is so important, and how the patients we have to motivate them to exercise and address their eating disorders and all that. Now coming to the physical activity, so when I say now there is a woman with 90 kgs, and when I say you need to lose weight, everyone wants to join the gym. Okay, so there are some people are affordable, some people are students, their timing don't match. So, is it exercise? Does it mean, Siddharth, is it only gymming is the thing, or what exactly do we mean by physical activity? Is it, how much of physical activity do you suggest to women with PCOS? And how yoga is beneficial? Yoga, Nayana is going to explain to us and demonstrate to us. But then when the patient comes to you and then you are telling them to be physically active, what exactly do you mean by that? How do you manage?
So exact scale, what we say is 150 to 300 minutes of moderate intensity workout per week. There is no need to.
No. As a patient, I won't understand 150 minutes and 300 minutes moderate physical activity. Tell me what and all I should do.
Walking, brisk walking is one concept. And then, of course, even walking on the treadmill is another concept which we encourage. And next, of course, jogging and running. That also can be a form of exercise. So again, this cardio and weights exercise will not necessarily apply to this category of patients. So I feel these three categories should be enough, man. Walking, brisk walking, jogging, running, and even walking on the treadmill. I think that should be an ideal workout.
Correct. Yeah. So like when we say at least, for adults, see, for adolescents, we want them to be more active. So we tell them almost up to 1 hour per day, you need to exercise at least in 5 days a week. So we give a weekend holiday. So we say at least 5 days a week, you need to exercise for 1 hour. That moderate physical activity can be swimming, can be jogging, can be playing any sports, and can be it can be skipping or cycling or gymming, aerobic, Zumba. Even in the YouTube, they can see Zumba and they can do at home. Even yoga for that. These all category will come for moderate physical activity. Whereas a strenuous or a very good physical activity is playing squash and swimming is again very high quality exercise. Apart from this aerobic activities, we want them to do resistance exercise, that is building up the muscle tone at least weekly twice. For adults, we are a little lenient. We say at least you do 30 to 40 minutes. For adolescents, 1 hour. For adults, we say 30 to 40 minutes of exercise. So when it comes to yoga, see what I feel is my PCOS patients I tell them, see, there is no need to join a gym and you need not spend money on that, or you need not fix it on the timing. So generally you do this kind of any activity, whichever you like. The important is they have to like it. If they don't like it, I can't push everyone to yoga. I can't push everyone to dance also. Whatever they like, whatever is feasible, whatever they can follow, they can do. And when it comes to yoga, apart from the physical activity, it will take care of two more things. That is the mental stress, sleep, and the muscle toning. So I request Nayana to just give me a little more insights about yoga in PCOS. How she wanted to demonstrate few yogas, because we are become more theoretical in the sense we are just telling do this, do that. Whereas Nayana is going to show us 2-3 asanas, which she feels is very, very important. It's very specific for PCOS. Please go ahead, Nayana.
We'll come to the demonstration part towards the end, ma'am.
Yeah.
So I think you summed up what I wanted to say. So whatever the experts spoke about, so you best to address all of it. We have asanas which actually work on your estrogens. We have asanas which your cortisol, whatever sits on your kidney. We have asanas which actually help you to lose and bring in a balance in your cortisol. And for stress also, so when we have various pranayamas, actually helps in bringing a balance in your sympathetic and parasympathetic nervous system. So most of you will know that parasympathetic nervous system body doesn't help you to clean them. So we have so many pranayamas, we have so many asanas, even asanas give food for your brain, like blood circulation it gives food for your brain. So it is excellent for all your anxiety, your stress, it helps you to manage yourself better. And then once you do that, we have after doing yoga, we have these of happy hormones, which I think so it releases lot of feels so good. Entire day you're charged and you feel so much energy is there. So walk, your jog. So these fall under cardio category. So Surya Namaskar in that advanced, like vinyasa and all, which actually enhances cardio. Serves as cardio for your it works with heart rate. So I don't think more of yoga here, because that's my job I have been doing for 25 years now. So in gym or in your aerobics or whatever, you will lift weights, but that will be limited, like 3 kgs, 5 kgs, and you'll go on increasing or go on. So here you're lifting your own body weight. There are so many asanas like Chaturanga Dandasana, Vata or Vashishtasana, where you're lifting your entire body weight. So that helps you to tone your muscle along with a balanced diet. So there will be a lot of protein intake. So that will help you to increase the strength of your muscle and you will look very toned. In yoga, first, rather than weight loss, you will tone first. And then weight loss will actually follow after that. So first you will start toning up your loose muscles in yoga. So it is very good to strengthen your core. Once your core is strong, you know how to entire body actually automatically becomes strong. Once core is strong, spine becomes strong, and then entire body. And then strong body, strong mind, strong body. So we can defeat most of the issues with yoga. So I think most of the asanas actually help in releasing a lot of enzymes, lot of all the chemical reactions can be controlled.
Correct. Yeah, so as rightly explained by Nayana, I think yoga, which is indigenous to India, I think should be practiced and should be advised to all women with PCOS, because one thing apart from the weight loss and the inch loss, because Dr. Siddharth was talking about the abdomen waist circumference or the abdomen circumference and how that is a very metabolically active fat, that is fat around the tummy, and how that has to go on, then how the muscle resistance is very important, or building up the muscle tone is very important. So apart from the exercise or yoga, or I can say some people don't like yoga, some people want to dance, but still I'll tell them, okay, you dance, no problem. As long as you are moving your body, as long as you are sweating and losing calories, that is enough for us. That is one thing. Second thing, apart from the doing this 30 to 40 minutes of exercise in adults and 1 hour exercise in adolescents, we have to teach them being active throughout the day, like taking stairs instead of elevator, walking to the bus stop, or going and buying stuff instead of ordering them to the house itself. Walk to the shop, walk to the hotel, walk to the, anywhere, keep walking, And so keep walking. And also there are a lot of women who are doing desk job throughout the day. So I'll tell them at least once in half an hour, just get up and walk at least, that getting up, at least even standing for 5 minutes also helps a lot, because sedentary lifestyle is very, very bad for us. That is the one which is killing the modern world. So they have to be active in workplace. They have to walk, take the steps. And when you're talking over phone, that is what we do most of us, isn't it? So when you're talking over phone, make sure that you keep walking. When you're talking to someone, keep walking, and don't do video chat all the time. Do audio also, so that you don't stumble on something. So keep walking. So these are all the small other tips apart from good sleep and good diet and avoiding stress and doing good exercise and yoga. Being active throughout the day also helps in PCOS. Now, before, I think, Nayana, will you be demonstrating in the end, so that I'll just summarize now? I think we have come to the almost end of the session. Unknowingly, we have finished 50 minutes of discussion. It's very, very interesting and learning point for all of us.
Sure. I would just like to add one point, ma'am. As Prutha had previously mentioned, like most of them, they don't even drink water because they feel they're scared to go to the restroom. I think they should drink more of water. At least then they will leave their desk and they will go up to the restroom. That is stand. So they should drink lots of water so that at least to attend nature's call, they'll get up from the desk.
Yeah, totally good. Also, drinking less water makes the women more prone for urinary tract infections, isn't it? So that is the reason women have to drink water and go to the washroom. Any washroom is fine as long as the urine which stays in the urinary bladder is more of a focus for infection rather than the dirtiest toilet. So I tell women it's okay, don't use commodes, but then at least you can go relieve yourself whenever there is an urgency. That way we can prevent the urinary infection. So summarizing, before I request Nayana to demonstrate the yoga poses which she has found over 1,000 plus PCOS patients, how it has helped them. So I just want one line summary from all of you, and I think we will keep the demonstration in the end, isn't it, Nayana? That's how we'll go. So I think Siddharth, what do you want to talk about lifestyle in PCOS? Your one line summary, please.
Be active, be healthy. I think that would be the easiest way to get the desired success. And of course, one point which we didn't touch upon, ma'am, still the treatment aspect.
Yes, please. Definitely, yes. Yeah. Apart from the lifestyle, we are talking about lifestyle. Mind you, this is for women who are who actually have not ended up in diabetes, who are not ended up in lipid dyslipidemia, so who are in the verge of getting complications. So people who already have developed complications, we have to inevitably and sadly take medicine. So that I think Siddharth, you just touch upon that.
Yes, ma'am. So, very commonly used medication I will be touching upon just in brief. First is the ovulation induction agents, where nowadays letrozole has replaced clomiphene citrate.
Yes.
The other one, because we have to improve the insulin sensitivity, we use metformin itself. So metformin also reduces the luteinizing hormone secretion. It improves the insulin sensitivity. It increases the sex-binding hormone globulins. It induces regular withdrawal bleeding. It prevents even endometrial hyperplasia, ma'am. So metformin is having almost like pleiotropic effects, what we say for medications, having multiple effects. So, and very commonly reduces the fasting insulin. Reduces the ratio of the fasting glucose to the fasting insulin. And it's really important that metformin is incorporated in case the lifestyle and dietary measures have not worked in women. So, and then apart from this, for the hirsutism part, we use the anti-androgenic therapy, very commonly spironolactone, then finasteride. And nowadays, the fourth generation progesterone, the drospirenone, is becoming very common, and it's combined with metformin to give effective results. Cyproterone acetate is second line, ma'am. So these are some of the pharmacological measures. Even after all this, we go for the surgical measures, as you would know, the bilateral ovarian drilling or laparoscopy, diagnostic laparoscopy. All of this is, of course, attempted. But these are the very commonly used medications which women will come across when they have PCOS, especially metformin.
Correct. Yeah. So basically, what Dr. Siddharth wants to stress is that, when we are talking so much good about diet and exercise and good sleep and reducing stress and yoga and all that, please don't forget that if you have already had, if you have been prescribed a medication by the doctor, there are different medications for different indications. So please, you may need to follow that also. Even though that could be temporarily used, but still lifestyle modification is something which is more of a permanent nature, because it has to be very, very long-standing disease and long-standing lifestyle change. Prutha, one sentence summary for your patients.
Follow any diet. Follow anything that you want to, but follow a diet which is sustainable, which you can do lifelong without making a lot of changes with what you're already doing, and also which is affordable. Don't jump in for fad diets.
Correct.
Follow what you can do.
Fantastic. Ramaya, the most important mental health component we have addressed in this thing. So what is your message to the patients who are having PCOS, how they have to safeguard their mental health?
Ma'am, one thing I wanted to add on is when we were talking about PCOS, diet, everything. So keeping good mental health is very important. And one more aspect, the substance abuse and PCOS thing, which is also very important for them to consider and avoid substance also, and keep your mental health good.
Very important, very important. Thank you so much, Ramya. I think so. I will summarize that lifestyle modification is one of the mainstay treatment in PCOS for both adolescents and adults who are undergoing treatment for any condition, like if you're going for cosmetic measure or irregular cycle or infertility or abnormal bleeding or any complication, lifestyle modification becomes a very, very important aspect. Now, I request Nayana to demonstrate few yogas. I request the admin to make Nayana's screen as a full screen so that people who are seeing, let them be benefited. So she will be giving us some yoga, 2-3 yoga postures which she has found useful in her patients crowd, particularly with PCOS. Nayana, go ahead.
Yes, ma'am. Thank you so much. And one line summary is, please invest time on yourself. Really do something like how to speak, how have should also become part of your lifestyle. If you like something, if you want, really take the time every single day that, come what may, I'm going to do these many minutes, I'm going to work out, at least basic I'm going to do. So, I'm not interested, these are all time for yourself. If you don't invest time on yourself, you will have to invest all the money you earned on medical bills. Okay, so please do invest time on yourself. Okay, on that note, I would like to start the first asana. This is Malakal. Previously, on the knee, ankle, and all. So the Malakal. So somebody who is already fit and that issue can slowly go down. Make sure that you use your elbow, push out your knees, tuck your core, so this works beautifully on your core and it is releasing a lot of blood to all your reproductive organs. Okay. So deep breathing, you can stay here for 10, 15, 20 counts as long as you're comfortable. Go ahead and you can stay. Now somebody who has knee issues, who's not able to perform, for them also we have a variation. You can sit slowly, then fold one leg, then the other leg, and slowly lift your hip up. Initially, you can take hand support. As long as you're pressing the floor, you can take hand support and stay here. Once you get comfortable, slowly you can start moving your hands. Okay. This was the first asana, Malasana. Next, we have something called as Chakki Talanasana. Previously, they used to do the Chakki. So they used to, all the ladies at home, they used to, which is why in previous generation PCOS was very rare. The only time you would miss a cycle was when you were pregnant. Apart from that, I don't think previous generations even knew what this was because they had such healthy lives. So the asana is similar. You have to spread your feet, sit down comfortably. You can do this on the bed, you can do this on the floor, wherever you are comfortable. Make sure your back is straight and you just have to go clockwise. We do this for about 5 rounds. You can see the amount of work happening on your sides and your core muscles. Okay. 5 counts and then anti-clockwise. You can again do this for about 5 rounds. Okay, it is similar to your Chakki pacing. Okay, so 5. You can complete Malasana, then you can do this. And then there is something called as Bhujangasana or snake, cobra pose. You have to lie down on your stomach, toe goes back, thumb touches your chest, inhale, touch your chest completely, exhale and go down. Open your shoulder, so what happens is, you tend to open your shoulder completely and see the amount of blood flow happening to your navel, to your core region. There is a lot of blood flow happening to all your reproductive organs. So it's very important to focus on your breathing. Inhale and up. Exhale and slowly go down. Inhale and up. Exhale and slowly go down. We can do this for about 10 counts. Then at the count of 10, you can just stay there. Deep breathing, look straight. Keep smiling. Enjoy the stretch. And stay here for 20 counts. Once you're done, relax. Turn your neck to one direction. Breathe in. Along with the other things I would like to mention. So, chest opening asanas, which we did now, Bhujangasana, Malasana, Chakki asana, all these help you to throw or release your emotions from your chest and this is your Agata chakra. So it helps you to release the emotions. People who find their hip joint very tight or they are not able to open their chest, that is because they have a lot of pent up emotions, which again leads to stress. So the asanas which involve chest opening or hip opening asana helps you to open up your emotions. Okay, so these are the basic asanas. At least if you can invest some time and do these 3 to 4 asanas, it is going to help us out.
Yeah, fantastic. Yeah, of course you make it look so easy, but then they are very, very simple asanas. I think all the girls can do it. Whenever they are back from work or from school, they can do it and practice. Yes,
if we have time, ma'am, is it okay?
Yes, we have time. Yeah, tell me. Please.
simplest asana, Baddha Konasana, butterfly. This is you can call it as a boon asana for women. Okay, you can do this during all 9 months of pregnancy, unless there is some issue, and you can do this throughout. Like even it is very good for your PMS issues also. So see, this is something that you can sit and watch TV, or when you're on your phone, or when you're talking, when you're cutting vegetables, anything. You can just sit like this and keep flapping. The more you flap, all the nerves here. It gives lot of blood flow to your internal organs and then to your uterus. It helps in having a healthy reproductive system. So whenever you're free, you can just keep flapping. And this is definitely very simple.
Absolutely. It looks easy and simple. I feel what I tell my students, there are a lot of these adolescent students giving 10th standard or 12th standard girls, and they are studying a lot, they have so much of homework, and then even the parents feel, no, she just can't get out and, and go for even to the park for an exercise and all that. So for them, I tell, and also for women who are working from home, people who have the luxury of working from home, if they have to sit for more than 8 hours and all, I'll tell them, at least after 1 hour, you take a break and you do Surya Namaskar 4 times or 6 times, both sides, three times, at least how much ever times. So at least that way, I think if you agree with me, because they can't dance in a small room, or, suddenly they want music, so their mind gets distracted. But I feel doing a Surya Namaskar simply, some 2 sets or 3 sets also will be helping, I feel. What do you say?
Exactly, ma'am. This does not, again, one more point, which is better, why yoga is better, because you don't need any equipment, you don't have to walk outside. And I would also like to add that, if there is some place, your balcony, your terrace, anywhere where there is sunlight, which falls on you, at least early in the morning, because most of them come with vitamin deficiency. So they don't even look out at the sun. So if you can just put a mat and do so at least 40 minutes per day you can invest on yourself. So it is very.
Yeah, absolutely right. So I think we have touched upon most and 90% of the aspects about lifestyle changes we need to include, or we need to advise to all the women with PCOS, irrespective of their age or their complaints or of whatever their metabolic issue. This kind of lifestyle changes, which includes diet and exercise and sleep cycle and mental health, keeping up the mental health, all these are very important. And few things these are the general and the research stage, is that the environmental toxins, that is limited usage of cosmetics, making sure that you don't use too much of chemicals, less use of plastics, microwave, reheating, freezing, deep freezing. So avoiding that habit, using steel, glass instead of plastics, and Teflon coated vessels and melamine plates, and then avoiding the pesticides, chemicals, using a lot of perfumes and air fresheners. These are the environmental toxins, we call them. So it is still in the exploratory stage how that can affect. And also a word about gut health, there is this gut dysbiosis, or there are very good bacteria which is present in our intestines, which protect us from a lot of diseases. There is a lot of research coming up on that. So make sure that you have a lot of probiotics, that is your milk, and sour food, that is our idli dosa is a probiotic, our curds. So whatever be South Indians, generally every day they have these kind of sour food. So that also helps. So these are all, make sure that your gut health is good. Make sure you don't take too much of antibiotics. So thank you so much, all my esteemed panelists, Dr. Siddharth and Prutha, Nayana and Ramaya. You are so good. I'm sure you have explained so in such simple words how to lead a good lifestyle for women with PCOS. Thank you, PCOS Society of India. Thank you, Durusha ma'am, Shobna ma'am, and team of the Vijeta, Dr. Priyanka, Dr. Neha, for organizing this program. I hope it reaches hundreds of girls. We do these sessions even in person. I go to colleges and then talk to them. But still, I think this combining all the lifestyle aspects together in single platform, I'm sure it must be very, very helpful to all the women with PCOS. Thank you so much for the listening. Thank you, panelists. Thank you, society. Thank you, Durshana. Thank you so much.
Thank you.
Shall we wind up?